A patient walks into your emergency department. They look stable. Their pulse is up a little, their oxygen saturation is on the low side. How do you know if they are about to crash? There is one number that catches deterioration before your eyes do. It is called NEWS2. NEWS2 is a standardized scoring system developed by the Royal College of Physicians in 2017. It takes 7 simple bedside observations and turns them into a single number that tells you how worried to be. Why does this matter? Because deterioration is sneaky. NEWS2 catches sepsis earlier, triggers escalation faster, and reduces avoidable mortality on acute wards. It is not a replacement for clinical judgment. It is the trigger that gets a senior to the bedside. Here are the 7 parameters. Each one is given a score from 0, which is normal, up to 3, which is the most deranged. Let me show you how it works. Respiratory rate 22, that is 2 points. Oxygen saturation 93% on air, 2 more points. Patient is on room air, no extra points there. Systolic blood pressure 104, 1 point. Heart rate 102, 1 point. Temperature 38.5, 1 point. And the patient is alert, 0 points. One critical pitfall. There is a second oxygen saturation scale, scale 2, with a target range of 88 to 92%. Use it only for patients with documented hypercapnic respiratory failure. If you apply scale 2 to the wrong patient, you will underscore them. Add the 7 subscores together. That single number is the NEWS2 total, and that total decides what happens next. Here is what each total means. 0 is routine monitoring, 12 hourly. 1 to 4, ward review and observations every 4 to 6 hours. 5 or 6, or any single parameter scoring 3, means urgent clinician review, hourly observations, and consider sepsis. 7 or more is a clinical emergency, continuous monitoring, and the emergency team. Let us put it all together. Your patient, respiratory rate 22, saturations 93% on air, blood pressure 104/60, heart rate 102, temperature 38.5, alert. Each row scores. Watch the total climb. Final score, 7. This patient does not look like they are crashing, but NEWS2 says emergency. Continuous monitoring. Senior review now. Sepsis screen. This is exactly the patient NEWS2 was built to catch. 3 things to remember. NEWS2 is not validated for patients under 16, in pregnancy, or in those receiving end-of-life care. Scale 2 is for confirmed hypercapnic respiratory failure only, and NEWS2 is a trigger, not a diagnosis. Your clinical judgment still rules. So, 7 vitals, 7 subscores, 1 total. 0 is fine, 5 is sepsis screen territory, 7 is emergency. If this video helped, hit subscribe next time we are doing Q SOFA. Thanks for watching.